All right, welcome back. Last video of the day for me today. We're going to do a video now on ultrasound. We're going to use our nice RX pad here as our patient because I don't have a patient in here I can do it with. But we're going to use the RX pad. It's been kind enough to volunteer as our patient today. So we're going to talk about ultrasound now. So ultrasound is the delivery of sound to stimulate tissue function, right? It works on the piezoelectric effect. That is, that electricity is delivered into a crystal. That crystal is in the sound head here. That crystal will begin vibrating a very specific frequency, and when it vibrates, it's going to emit sound waves from the head here. We're going to use a conductive material, in this case, ultrasound gel, which is nothing more than really, this is medium viscosity, multi-purpose ultrasound gel blue. Primarily, this is petroleum jelly and water. It's basically Jello. So when we're doing ultrasound, what type of stuff might we do ultrasound for, right? Well, it depends. We're either doing it for heating or healing. So again, I'm going to break out my little clipboard here. When we start with ultrasound, what we have to figure out is what are we going for? If you're looking at your patient scenario, specifically dealing with your practicals or with your comps, if they're talking about muscle tightness, muscle soreness, muscle contracture, what we want to do is heat the tissue up. So we're going to go for heat. If we're talking about repair, such as an ACL repair, an LCL repair, PCL repair, anything like that, or bone fracture, at that point we're going for healing. So we have to determine, again, like the chart I did with E-stim last time, we're going to look, are we going for a heat effect or are we going for a healing effect? That'll determine the parameters on the ultrasound. If we're going for a heating effect, we're going to want the ultrasound to remain on at all times, which means I can spell today. Continuous. Yeah, that's bad spelling. Continuous. We want a continuous ultrasound, right? We want it to be on at all times. If we're going for healing, we're going to go for pulsed. Pulsed means it's going to be on a period of time and off for a period of time. On a period of time, off for a period of time. So, again, if we want to relieve contractures, muscle soreness, stuff like that, we're probably going to want to heat the muscle up. We're going to do continuous, right? That means on a continuous, our duty cycle is 100%. Pulse, we can have 10%, we can have 20%, we can have 50%. Some of the machines even have, 30, 35, 55, stuff like that. But that's the idea between pulsed and continuous. Are we going for heating or are we going for healing? Once we know that, that's going to determine our duty cycle. A couple other things we need to determine. We need to determine our ultrasound head size, right? So it goes without saying, the larger area we're treating, the larger ultrasound head we're going to need, right? How do we determine what size ultrasound head we need? Well, on the cable of every ultrasound is this beautiful tag. On the tag, right, on that tag, there's a bunch of numbers. One of the ones you're looking for is ERA. ERA means effective radiating area, right? So that means how much of this head at one time is on. Typically with most ultrasound heads, you're going to have an ERA of about 1 centimeter less than the total size of the ultrasound head. So in this case, we have a 5 centimeter ultrasound head, right? That means the ERA on this one is 4 centimeters squared. You can treat 2 to 3 times the ERA in a square area. So in the case of this ultrasound head where we have 4 square centimeters, we can treat an area that is 8 to 12 square centimeters with this. So ERA, you can treat an area that is 2 to 3 times the ERA. So for a 5 centimeter sound head with a 4 centimeter ERA, we can treat 8 to 12 centimeters of treatment area. If the head is larger, if say it's a 15 centimeter sound head, and you have 14 centimeter ERA, you can treat a much larger area. Most of your traditional sound heads are going to be, there's a 1 centimeter, There's a 3 centimeter, a 5 centimeter, and a 10 centimeter. Now there are some other odd sizes from different companies, but those are the most common ones I've seen in the area. 5 centimeters, your by far most common sound head, right? There are a couple other numbers on this. There's the frequency. It tells you which frequency we can use. We're going to talk about that in a second. There's a BNR. BNR is the beam non-uniformity ratio. It's how much that beam is going to be columnated or non-columnated. How easy is it for that beam to diverge once it leaves the ultrasound head? Traditionally, ideally, you would want a 1-to-1 BNR. But no ultrasound head is ever going to be 1-to-1. Not with the shape of the ultrasound head. It's going to column no matter, or it's going to cone out no matter what. But the closer you can get to 1-to-1, the better. If you have a 10-to-1 sound head, not a great ultrasound head, right? That is not going to send as much of the energy into the direct area. It's going to spread it over a wider area. The sound heads we have in here, these are 5-to-1s. I believe that one of the other units we have is a 3-to-1 BNR, meaning that if we've got 4 centimeters, it can go all the way out to 12 centimeters wide. So you have to be careful when you choose your BNR. You want a nice columnating sound head so everything's going down. You got the size of the sound head. Obviously, it's going to give you your treatment area and stuff like that as well, and your compliance. So these are Chattanooga units. There's all kinds of units out there. There's BTL. There's everything like that. All right, so we're going to plug this sound head back in because we're going to say that our area is within the ERA of this sound head. Why are you not plugging in? There we go. All right. So we've determined what we're going to do. So we're going to say that we're trying to heal this patient. This patient here, our poor patient, has a torn ACL. Trying to write upside down doesn't work very well. So he has torn ACL. So then we're going to go for healing. The next thing we need to determine is, are we going deep? Are we going superficial? Or shallow? Okay, that's going to determine what? Well, that's going to determine our frequency. If we're going deep, we're going to do a lower frequency. If we're doing superficial, we're going a higher frequency. So, if we go deep, right, we're going to go 1 megahertz. That's a standard deep tissue frequency. Like low back would be great for that. Calves on certain people. Some people's shoulders even. We may even have to go deep, right? Pecs. Lats, stuff like that. Superficial is going to be stuff closer to the skin, right? And the ACL will be pretty close to the skin, so superficial we're going to do 3 megahertz. So we know we're going to heal the ACL, so we're going to do pulsed. We're going to do superficial because we know it's superficial. So the last thing we have to determine is how much output we're going to put. So what is the actual intensity we're going to use? Most intensities on ultrasound, for by and far, if you go to the clinics, most clinics are going to use 1.8 watts per centimeter squared. You're going to ask them, why do they do 1.8 watts per centimeter squared? And no one's going to know. It just seems to be that we've always done this 1.8 watts per centimeter squared in a lot of clinics. And if you ask most clinicians, they'll tell you, oh yeah, I do 1.8 watts per centimeter squared. Why? I don't know, right? This is where we kind of go into play. We can start as low as 0.5 watts per centimeter squared and go all the way up to 2. You get above 2, you start getting to a little bit of a hot spot area. We don't want to get that. But depending upon the area and depending upon the size of the person will depend upon your intensity. It's also going to determine your pulse width, right? So if we've got somebody that's really tiny, we may start on the conservative side and start at 10%. You know, for most ACLs, we do 20. But say we've got somebody that's a really, really low body mass. We may want to drop it down to 10 so we don't cause unstable cavitation there, cause them uncomfortable feeling. It's not going to hurt them. It'll just feel uncomfortable. One warning with ultrasound. Make sure that if you're going to do ultrasound and you know where area you're treating, make sure you do not run the ultrasound over any exposed nerves, such as in the cubital tunnel, right? In the tarsal tunnel, down where the fibular nerve passes right anterior to the knee, right? Any of those areas, when you run it over a nerve, those sound waves are going to go in and bounce off that nerve, and it zings. They'll let you know. So you want to make sure you're careful and you understand. That's why you have to know your anatomy when you're treating a patient. You have to know. This is what separates a tech from a PTA, is knowing your anatomy and not harming your patient. You do not want to harm your patient. Tech should not be doing ultrasound. That's beside the fact. I'm going to say that outright because this is a skilled therapy. But the reason why we are trained in this is because we know our anatomy, we know what we're doing, right? So we're going to say this is our patient. One of the first things we're going to do is we're going to get the patient, right? So we're going to use a little bit of a marker here. So we're going to say, here's my ACL region. Okay, so I've got an ACL region. I don't know if you can see that very well, but I've got an ACL region. I'm going to put my ultrasound gel down. How much ultrasound gel do I want to use? Well, a lot. You don't want to swallow the area so it makes a huge mess, but you want enough that when you're moving it around, you have consistent and constant contact with the ultrasound head. The ultrasound head cannot lift off the area. It cannot come into a contact with an area with no ultrasound gel. And it cannot just suddenly miss an area. So you need to make sure that you're conforming to that area and moving that gel around as you're doing ultrasound, right? So my wire's all tangled up here. Let me get it untangled a bit. So how fast do you move your ultrasound head? How fast do you think it is? Well, they usually say, right, so when you're moving the ultrasound head around, it's going to depend. So your comp says 4 centimeters per second. I've heard up to 5, right, but mainly 2 inches per second is what you're going to do. So you're going to have a nice steady pace. So if this was our area, right, 1, 1001, 1, 1002, 1, 1003, 1, 1004, 1, 1005. We want a nice slow delivery. We don't want this, right? We want it nice and slow because when you do that fast, you lose your ultrasound gel. So we're going to set our machine up, turn on the machine. You can also set the head to warm up ahead of time. I usually don't do that because I want it to get too warm for the patient. So in this case, we're doing healing. So we're going to set it for a 20% duty cycle, which I've got it set for. We're going to do a shallow tissue treatment. So we're actually going to adjust the frequency to 3 megahertz. How long do we do it for? Well, each area that we do is about a 15-minute treatment area, 7 to 8 minutes, depending upon the area, right? So usually each area we do, we're going to do about 8 minutes of an ultrasound to it. So we're going to set this for 8 minutes, right? And then once we got it, now we've got to put the ultrasound head on before we can adjust the intensity, because we cannot adjust the intensity until this head is moving, right? So we got my ultrasound head moving nice and slow. Now I can adjust my intensity and bump it up. So I'm going to start adjusting it up, right? And once I've got that intensity set where I need to go, now I'm going to start my timer. And so now I need to keep that ultrasound. I cannot pick that head up. I don't have the sound head on, don't worry. I cannot pick that sound head up. I cannot go like this, where I've got it tilted. I have to keep it in conforming with the body area. Nice and slow. Go out and take some of that ultrasound gel and bring it back in. I didn't pick up. I just scooped and swapped. Boom. Keep it nice and steady, right? So 4 centimeters per second. Your ice massage was 5 centimeters per second, which got you set up to do this. We're going to keep going, and we're going to keep getting feedback from our patient, right? We're going to ask our patient, how does it feel? Are you feeling anything? With a pulsed ultrasound, should they feel anything? No. Well, they're going to say, well, I didn't really feel anything. That's what we're going to tell them. It's working at that cellular level, right? It's going down and stimulating that area to heal the area. Probably not going to feel anything. A lot of times what I've heard from patients is we'll do ultrasound. About 20 minutes later, like, man, I feel a little bit better. And I'll tell them it's probably because now the ultrasound, all that energy has been delivered to the area, and the cavitation has caused the microcurrents, right, those bubbles up here. And now it's starting to get the increased blood flow and improve the circulation in that area. So it does take a little bit of time, sometimes 30 minutes. With the continuous ultrasound, they will have a heating effect, so they may feel the ultrasound head get warm. Again, we want to make sure that it doesn't get too warm for them. If you stop somewhere along the lines, when you're doing this and you stop and you hold it, you're going to get unstable cavitation. You're going to get a hot spot. And they're going to say, ow, you're burning me, right? Don't burn your patients. Keep that head moving at all times, right? 4 centimeters per second, right? 2 inches per second. Keep it moving the entire time you're treating a patient. As long as you keep the head moving, you keep it in contact with the patient, you have sufficient conductive material, which is your ultrasound gel, you can't harm a patient, right? And there have been numerous studies out there that have shown ultrasound is very beneficial for patients, especially in the healing factor, right? So if we do the heating, the continuous factor, they're still going to get the healing effect, right? But if we do the healing effect, they don't get the thermal effect. They're not going to feel a warmth, right? What are some contraindications to ultrasound? Anytime that we have any type of energy delivery modality, obviously cancer is a concern. We don't want to do this over cancer. We don't want to do this over the eyes or the ears or the nose, anything silly like that, mucous membrane type activity. Probably don't want to do it over a pregnant uterus. That would be bad as well. Anytime we have an unstable fracture where the bone is not completely set yet, because we're going to be causing sound waves to go in, right? How do we check for a broken bone? We check by hitting a tuning fork and putting it on the bone and causing the bone to vibrate. Same idea with this. This will cause the bone to vibrate and it'll hurt. So you don't want to put this over in a fresh fracture or something like that. We want it to have a nice stable callus before we actually go ahead and start doing any ultrasound on it. Where can we do ultrasound? We can do ultrasound anywhere. Pretty much anywhere that you can get the ultrasound head to conform to. Obviously, maybe if you're doing it for the hand or something like that, you may need a smaller ultrasound head, or you may have to do immersion method, which is where you're going to put that limb underwater and you're going to hold the ultrasound head a little above it, right, about 2 inches, and then you're just going to do the normal effect. What's happening is water is then your conductive material, and that water is sending the sound waves down into the hand. A lot of times when you're doing, especially if you're doing the hand or something like that, and mainly a lot of patients will get that trigger finger where their finger's stuck like this, so we're doing a continuous heating to kind of straighten that finger out. We're going to go up and down that finger and all that bound down tissue area in water. And they're going to say, I feel it in my whole hand. It kind of feels achy. And you're going to tell them that's normal, right? And they'll get a gentle heating effect. I find I get a better heating effect with underwater ultrasound if I make the water warm to start with. If you start with cold water and you put a sound head in to warm up, it doesn't always work. So you want to make sure that you start with whatever you're appropriately doing. The other method you can do with this is bladder method. In bladder method, you're going to take some form. Now, they make specific ultrasound bladders, and what they are is these little baggies that you fill up with water, or you can fill them up with ultrasound gel if you want to be fancy. And then you're going to place that bladder, you're going to put ultrasound gel down, you're going to place the bladder down, and then you're going to place ultrasound gel on top of it. And then you're going to be doing ultrasound through the bladder. That could be really good over bony prominences. Maybe you have to do something on an ischial tuberosity of somebody that's got a real bony butt. Or maybe you have to do it over the lateral malleolus or the Achilles tendon, which is a real kind of small, fine area, right? Out here, sometimes some people with that epicondylitis, maybe that area is too small for you to do with a 5-centimeter sound head. You may need that bladder in order to do it. The hand's another area. You could do bladder over the hand as well. Any of that works. But the idea is with ultrasound, you need to make sure that you have your conductive medium. Whether that's ultrasound gel or whether that's water, you need a conductive medium. You need to determine, am I doing heating, i.e. continuous, i.e. 100% duty cycle, or am I going for healing, i.e. pulsed, i.e. 20, 10, 50%, whatever it may be based upon your treatment area. Once you have that, you're going to need your time that you're going to do it, your ultrasound head size, and then your intensity. And again, most times, for most areas, if you have a very superficial, very shallow area, you may want to start at 0.5 watts per centimeter squared and work your way up. If you have a larger area, you're probably going to have to start in that 1 to 1.5 watts per centimeter squared in order to get an effect. So it's all about knowing your patient's size, what you're doing with it, whether you're going for heating or healing, and whether you're going deep or shallow. Remember, because deep, we want 1 megahertz in the frequency. Shallow, we do 3 megahertz. And we talked about that a little bit in physics when we talked about Wi-Fi too, right? We talked about the two main frequencies of Wi-Fi right now is 2.4 gig and 5 gig. And then if you have a house that has really, really thick walls, that 5 gig, because of the increased wavelength or the increased speed, doesn't penetrate as well as that 2.4. So you may want to go with the 2.4 band in those areas. Same idea here. The slower frequency, so that 1 megahertz, allows that wave to penetrate a lot deeper, allowing it to get to deeper tissue structures, right? Especially in that low back region. You're not going to want to do 3 megahertz back there, because you're probably only going to get the superficial tissue. And that's not going to help them. We want to get down to those paraspinals and those muscles around the spine to help them, or maybe into the lats or into the pecs, anything to that effect. I hope you found this video beneficial. It's about 20 minutes long. If you have any questions, please feel free to email me. Thank you very much.